Brace yourself for a startling wake-up call. In 2026, Medicare Part B premiums are set to surge by nearly 10%, marking the second highest increase in the program's long history. This isn't just a number, it's a direct hit to the wallets of millions of retirees, potentially eroding the gains from Social Security adjustments and amplifying the financial strains already squeezing everyday Americans. But here's where it gets controversial. As we dive deeper, you'll see how this hike sparks debates about fairness, government responsibility, and who really bears the brunt of rising healthcare costs. Stick with me to uncover the full picture and why this matters more than ever in today's economy. Why this spike hits so hard. Picture this. While the cost of groceries, electricity, and basic necessities continues to rise sharply, as explored in this related Newsweek article on shifting Medicare Parts A and B for 2026, this premium jump adds another layer of pressure on families juggling employer-sponsored health plans or Affordable Care Act options. It's a trend that's leaving many Americans scrambling to make ends meet, turning what should be a comfortable retirement into a battleground of budgeting woes. Key details you need to grasp. According to the Centers for Medicare and Medicaid Services, learn more via their official fact sheet on 2026 Medicare Part B premiums and deductibles. The standard monthly premium for Medicare Part B is climbing from its current level to $202.90 starting next year. That's an extra $17.90 per month, or a 9.7% boost, putting it as the second largest dollar increase on record. To put this in perspective, the biggest jump ever was $21.60 back in 2022, as noted by independent Social Security and Medicare expert Mary Johnson. For those new to Medicare, let's break down Part B simply. It's the part of the program that covers outpatient medical services, such as visits to your doctor, preventive screenings like cancer checks, laboratory tests, durable medical equipment, think wheelchairs or oxygen machines, and certain home health care. Unlike Part A, which handles hospital stays and is often premium-free, Part B isn't mandatory, but most folks sign up because it fills the gap for routine and essential care. You'll pay a monthly fee, and after hitting an annual deductible, you might face coinsurance or copays for services. Enrollment typically kicks in around age 65, or sooner if you're eligible due to a disability. Think of it as your go-to coverage for everyday health needs outside the hospital walls, ensuring you can get that flu shot or blood work without breaking the bank entirely. These premiums aren't just another bill. They're automatically pulled from retirees' Social Security checks each month, making them a focal point for financial planning. And this is the part most people miss. While Social Security benefits will see a uniform 2.8% increase across the board next year due to the cost of living adjustment, COLA, the Medicare premium hike acts like a thief in the night, nibbling away at those gains. The net COLA, what you actually pocket after expenses, hinges on how much the Part B fee rises. For the typical retiree who might receive about $2,008 monthly as of August 2025, this $17.90 uptick slashes the effective COLA to a mere 1.9%. For those on lower incomes, say earning $1,000 per month, it drops even further to just 1%. In real terms, imagine a senior budgeting for essentials. This could mean cutting back on a weekly meal out or postponing a small repair, just to keep up. A silver lining, or is it? Not every beneficiary will feel the full sting. Thanks to a safeguard known as the hold harmless provision, if the premium increase outpaces your 2026 COLA, your monthly Social Security payout stays the same. No cuts, no gains. This protection kicks in for those whose monthly benefit falls below $640, where the COLA wouldn't cover the $17.90 hike anyway. It's designed to shield vulnerable folks from double whammies, but, and here's where controversy brews, critics argue it creates an uneven playing field, potentially favoring some groups while others absorb the brunt. Is this fair, or does it mask deeper inequities in how we fund seniors' care? It's a point worth debating, as it raises questions about whether wealthier retirees indirectly subsidize the system or if lower-income individuals are left behind. Voices from the experts. The Centers for Medicare and Medicaid Services explained in a press release that the uptick stems primarily from anticipated rises in medical prices and usage patterns, aligning with past trends. Meanwhile, analyst Mary Johnson warns that the public might see this as a major bite out of their COLA, continuing a cycle of relentless financial pressures on everyday consumers. Her words highlight a growing frustration. Why do healthcare costs keep climbing when many feel they're already stretched thin? Looking ahead to 2026 and beyond. These adjustments roll out come January 2026, so now's the time to review your budget and explore options like supplemental plans if needed. But as we wrap up, let's ponder the bigger picture. Should Medicare premiums be capped or subsidized more heavily by taxpayers to ease the load on retirees? Do you believe this increase reflects true inflation in healthcare, or is it a sign of broader systemic issues? And what about the hold harmless rule? Is it a lifeline or an outdated patch that ignores income disparities? Share your opinions in the comments below. I'd love to hear if you agree, disagree, or have your own take on how we can make Medicare more equitable for all.